In 1998, there was a confirmed case of HIV in the country, and by the year 2000, there was a full swing of the promotion of awareness. Creation of awareness was in full swing by 2000. So there are people who are going around and creating awareness of this pandemic, so to speak. I think it was declared a pandemic by then. I'm not really sure. But so there was that. It was in full swing. The problem was that the character of the people never actually changed. Everyone still was the way they were. The youth weren't really changed in their inclinations. They still had their drives in place, and they were still going at it regardless of the information going around. So this awareness only introduced a factor of fear. It didn't actually change the behavior of the youth. So the youth kept doing what they were doing, and the adult as well, obviously. So this awareness kind of just introduced a factor of fear and mistrust and such, but didn't really actually change the behavior of the people who are supposed to be being corrected or being helped by being informed. So this goes to show you a little bit of the human character. The human character has, very little to do with facts. Facts don't really drive how people behave. Facts are just that, they are facts. Emotions do drive how people behave, and these inclinations, these feelings, these are the ones that would actually determine the behavior of the people. It's not the information that is out there. So I don't know how they were supposed to have resolved it, but obviously it wasn't all that effective because of that. So after a while, it became really clear that the campaigns weren't really working, and they were not deterring people from, going at each other. So they had to do something else. They decided to look for preventive measures. So this is where we got the protections coming in, and they realized that this would actually be a bit of a better solution because people are not going to change because of the information you give them. So the campaign started of providing protection, and this actually had quite a bit of an impact because people are actually using the protection. The protection helped in two ways. It would avoid those teen pregnancies that people didn't want, and it would also protect them from this ailment or pandemic. Damn it, the wind. We've been dropping into a valley, and the wind has seen it fit to just keep picking up. It has been ratcheting up since then. Anyway, luckily we have some trees up ahead, and hopefully there will be a bit of a windbreaker for that. So, where are we? We are at the point where they decided to use protection because the awareness campaign wasn't really working. It was just introducing an element of fear, but people were still doing what they were doing because they are driven by emotions. We are emotional creatures after all, so emotions rule. So they had to use a more practical means of preventing the spread. So that's what they did, and it kind of worked. But I guess it wasn't good enough because there were still cases of infection going around. And this is where it came to the third measure, the measure of using managing the condition. The condition had to be managed. Alright, I think here we are safe from the wind. The only problem is that now we might not be able to get any sun on us. Completely in shadow, under the cover of trees and all. Anyway, this should be good enough. All right, so the reason why this actually became a problem is because of how humans work. This condition, the HIV, was spread by, well, through sex. So it was assumed that if you are getting infected, you are being promiscuous, which is not exactly the case because it can also be transmitted by a few other means. But that's not important. What's important is that the stigma attached to the condition led to it not being handled properly in health facilities, because health workers do deal with a lot of things. So when they get someone with this condition, it kind of feels like an unnecessarily additional task to their already full docket. And when this happens, you start to get a bit of a mistreatment going. They're not necessarily mistreating you, but they kind of are, because of how you'd feel based on what you have. Because if it was any other thing, if it didn't have a stigma attached to it, regardless of how you are being treated, it wouldn't really matter all that much. If you are suffering from malaria and someone is not treating you all that kindly, there are always cases of people complaining of how, let's say, nurses are handling them, locally at least. And this is not just limited to someone with some taboo ailment. It was to everyone, but now that this condition had some taboo attached, it was even worse. So the people who were afflicted wouldn't want to go to the health facilities for treatment because of the supposed bad handling of their situation. So they had to come up with these organizations which are separate, which are not exactly health facilities, but they could handle these patients. So that's how that came to be. And with these organizations in place, the NGOs, it became quite the money cow. The venture became so lucrative to those who are providing that kind of support that it's very difficult for them to try and give that up. I mean, it is possible, but it would take quite the fight to get them to give that up. Obviously, they could do other things, but if this one is working, why mess with it? So I would think that would be the primary motivation behind people trying to keep this thing going as is, instead of trying to find a better solution. Not just find a better solution. Instead of just using a better solution which exists, there are these botanists and the likes who have managed to find a way of getting rid of the virus. But given how lucrative the virus is, you can't really expect those people who are managing it to try and get rid of it. So it's upon the patients themselves to find these people who can cure them and use the cure. It's not going to fall upon the people who are providing aid to help you find the cure and leave the program, because you being in the program as a patient is actually what's bringing in all the lucrative deals. So that's what's up. That's the problem. If you're trying to provide a solution or a cure for these patients, you're fighting against those people who are very well funded. So that's the battle. You with no funding at all and no backing against those who have all the backing they could want. So that's the problem. How do you resolve that? Question for you.